my Facebook page to see if we're live?
Let me check your Facebook page too.
Do you see it on your phone yet?
No, not yet. I'm just refreshing. Yes, ma'am. I think we're live.
Okay. I just refreshed mine. We're live.
Let me go share. Sharing.
Let's see here.
People. I got to find it first, though. You see it?
Not yet. I'm not seeing it on my page yet. That's weird.
Yeah, I'm not seeing it either. That's weird.
All right. Let's go back on here. It says going on Facebook.
It says live.
Yeah, it says live.
I don't see it. Unless I'm on the wrong page. No, I'm on the right page.
Oh, am I on? Are we on the regular page?
I'm on the Dr. Firlande page. What page are you on?
Yeah, that's the page.
Okay, I don't see it. I mean, I know it says live, but maybe you're live on the other page. Let me go check your other. It says, no, you know what? I think you're live. You're live on your private page. Hi, Leslie. Hi, Leslie. We're supposed to be on another page. You're on your personal page. Let me go check your other. It says, no, you know.
Oh, I'm on my personal page.
Yes.
Oh.
We're going to log off and we're going to
oh, no. I was supposed to be on the other page. Okay. That's fine. We're going to roll with it. Oh, I see us. Okay.
Yeah, so log off and go.
Perfect. Awesome.
Wait,
awesome.
You want to do it here? I gave everybody else a different page. Hold on. So let me go to your page then. Hold on.
Okay. I could.
That's fine. Let me just go to the right page. Yeah. Sorry, guys. Give us 1 second. Yeah.
Yeah, give us 1 second. I was supposed to be on my other page. Never mind.
Let me just share, and then let me share here to a group.
Share. I'm going to share on my page. Sharing is caring. Go ahead and share. This broadcast is going to be awesome.
And then I need to, I think I shared it on my personal page and to one other page, and then we're good to go. Honey, I think I have shared away. So let me make sure I can see the comments in case anybody has any questions. I think we're good. I can see.
Okay. Awesome. Hello, everyone. Hello. Wherever you are, I am broadcasting from Alaska. It's actually a beautiful day today. No, it's not snowing. So I have my good friend, and I will have her introduce herself in a minute. But let me introduce myself. I am Dr. Firlande. I'm a licensed naturopathic physician. I'm also an author, speaker, and your weight loss expert. In my coaching program, I offer natural solutions to women who are between 20 to 50 pounds overweight so they can have the courage and confidence to love themselves and their lives while they are managing their weight. Listen, y'all, today is going to be awesome. I have my very special friend and colleague, Dr. Samm Pryce. Dr. Samm and I went to medical school together. We actually graduated a year, but she was 6 months ahead of me. So I've been known her for a long time. She's my super friend. She is an awesome, awesome, awesome person to have in your life. And I want her to go ahead and introduce herself.
Thanks so much, Dr. Firlande, for having me. I'm super excited about this. We have known each other for like over 15 years. I don't think you realize that, but it's been that long. I am Dr. Samm Pryce. I am a licensed naturopathic physician, just like Dr. Firlande. That makes us experts in natural medicine. I am a wife and a mom, and so the mom title now gives me the title of counselor, principal, and teacher with coronavirus. So with my number one best-selling books, my concierge medical practice, where I offer one-on-one VIP level medical attention, and my live event, Vital the Experience, which Dr. Firlande is a 2020 speaker. I help you bridge conventional and alternative medicine to treat illness into wellness. I am super excited to be here. Thanks so much for having me, Dr. Firlande.
Yeah, it's my pleasure. It's my pleasure. I had been listening to you for a long time, and I've been listening to the information that you've been given on COVID-19, and I'm just like so excited to have our listeners and our viewers just listen to you today. And so we're going to be talking about our topic.
Yes.
Can you hear me okay? We are slightly delayed. Okay, but that's fine. We're just going to roll with it. We're going to roll with it. So today our topic is COVID-19 virology. So Dr. Samm is going to go over all of that. She's also going to be talking about some naturopathic care. And she's going to end with like why we should not be taking ibuprofen or Tylenol if we have a fever. Okay, so I'm gonna go ahead and get her started. So, Dr. Samm, tell me a little bit about what you know about the coronavirus and how can you break it down for us, for our listeners, just the mechanism on that virus?
Virology, if you haven't studied it in recent years, is complicated, but our body is amazing. So I actually wrote notes for you guys. So you'll see me like peer down because I want to make sure that you guys are getting the information right. I want you guys to really understand this. When you're understanding things, you tend to be more compliant and you can understand the news that all of the other doctors are telling you, and you can disseminate the information the way that you want to, but it will be correct. So that's really important to me. So a virus in general is an infectious agent that needs an actual host in order to replicate and cause any harm. So this virus, when it's on a surface or anything like that, it does nothing. It does nothing. It needs a host, and we are the host. Okay, so the coronavirus that everybody is talking about is actually a family of viruses. So your common cold is in that family. So we've known about coronaviruses for a long time. So the common cold is in there, something called MERS, which is Middle East respiratory syndrome, and then SARS, which is severe acute respiratory syndrome, right? So this is a new type of coronavirus. It's in the family. We're calling it COVID-19. So CO is for corona, right? V is for virus, and the D is for disease. And then 19 is the year in which it was discovered, right? So we know it came from Wuhan, China, so it was in the year 19. However, COVID-19 is actually the disease process. The actual virus itself is called SARS-CoV-2. So because it is a severe acute respiratory syndrome from the coronavirus 2, okay? So that's the name of the virus. Probably going to use them interchangeably. So if I say SARS-CoV-2, you know I'm talking about the same thing. So when we're talking about viruses, you have to understand how you get infected. And that's what we talk about when we're talking about it's contagious. Viruses are contagious because you become infected. So there's a couple of different ways to be infected and the reason why it's contagious. So one is you can get it from contaminated objects. So objects, metal. So we know right now, at least in the very beginning, it was like, oh, it can only last on metal for 72 hours. That's a long time. However, recently, I think today, that it can actually last on metal surfaces up to 9 days. So it could be 9 days that it plopped down on that surface, and then now you're touching it 9 days later and you're getting it. So it can last a really long time on metal surfaces. So I'm going to suggest you guys not wear rings and jewelry and stuff like that when you go out. It's okay, but don't wear that kind of stuff. So cardboard, it can last on cardboard for 24 to 48 hours. So we're talking about boxes that you get on the porch from Amazon. We're talking about cardboard boxes from the grocery store. We're talking about packages that you get in your regular mailbox. Copper. I thought this was really interesting. So copper is supposed to be and we think of copper as being a great piece of metal for being antibacterial, antiviral. Well, this virus can last on copper for up to 4 hours. So don't think that copper protects you. Right. So plastic, it can last on plastic for up to 3 days. So I want you guys to think about if you're buying juice or if you've got plastic bags that your groceries are coming in that needs to be thrown away or sprayed down or any kind of plastic. So that's up to 3 days now. And then it's also contaminated objects or contagious objects. You get infected by droplets. So I think this is what most people are hearing about. But the droplets we now
right.
We now know that the droplets can also be aerolized. And aerolized means that it can like float in the air for about 3 hours. And that's kind of where everybody's going now with the whole masks. And we'll talk about that in a minute. So coughing and sneezing. So you need to protect.
That's pretty scary.
It's very scary, actually. So coughing and sneezing, any kind of personal contact, so like touching different people, that kind of stuff, it actually enters your body. So the way in which it's contagious. So now we're going to enter the body. The virus enters the body through mucous membrane, right? So eyes is one of them. And I don't think most people are talking about the eyes. It's very rare that you're going to get this virus through the eyes, but there's a 1 in 1,000 chance. And so I want you to know, and that's why they say don't touch your eyes. Right? So it's not your regular conjunctivitis that you're thinking about. This is a virus. So those antibiotic drops that you would normally do, that's not going to work. So we have to treat it the same way, right? So I want you to know you can get it through your eyes. Your nose and your mouth are the most common, but I'm going to say your ears as well. So what happens is the virus is going to work its way down. It's working its way down to the body. This virus specifically has S proteins or spike proteins, and it looks like a crown. So that's why they call it coronavirus. So it's actually really pretty. It looks pretty if you look at it, right? So the S proteins are actually used to grab onto other receptors from our healthy cells, and it cleaves those receptors. So the SARS, I got a delay, sorry. So SARS-CoV-2 specifically likes the ACE2 receptors, and these we find in the kidneys, the lungs, and the GI tract specifically, those 3 areas. And so that's why we're seeing all of these symptoms that are associated with cardiovascular issues, shortness of breath, diarrhea. So we'll talk about the symptoms in a minute. But once it's down in the lungs, because that's the most predominant symptoms that you're hearing about is lung issues, right? So once it's down in the lung, it uses the host, which is us and our healthy cells, to replicate. So it cleaves off that receptor. It goes inside of the cell. So now it's infected in your cells, and it replicates and it multiplies like cockroaches. You just can't get rid of them. So it's like replicating, and it literally takes over that cell and it strangles it. It literally strangles it. So what is happening when all of this is going on? So normally your body would recognize a foreign invader. So we call those antibodies. So the reason like our cold and our flu, some people get it, some people don't. It's been around for a while. The different variations have been around for a while. We've built up antibodies to it. So our system says, oh, I recognize that. Let me go call my immune system and take care of you like that. You might not even see symptoms of anything. But what's going on now is this foreign invader, our body has never seen it. That's why it's called the novel coronavirus, right? We've never seen it. Our body doesn't have any kind of antibodies to it, so it has no signaling to say, hey, I need help, right? So this is the reason why it can be in your body undetected for 2 to 14 days. So you can be asymptomatic, your immune system's not helping and not calling in invaders. And when your immune system calls these people in, you have symptoms like the fever, the cough, that kind of stuff. That's how you know something's going on. But this one goes undetected.
Right.
Our antibodies just don't recognize it, right? So I want you to understand that you're asymptomatic or you don't have symptoms for 2 to 14 days. What were we going to say? Okay.
Oh, so I was going to comment on that, which is very important. Why, you should stay home, because you could be carrying the virus and not having any symptoms.
Exactly. So you don't know whether or not you're contagious, but you're asymptomatic for 2 to 14 days, right? Because your body doesn't know to tell you and say, hey, I'm fighting something. It doesn't even know because it doesn't recognize it, right?
Right.
So now let's talk about, we're deep into the body. Now you have symptoms, right? So now you have a fever, a sore throat, something is going on and you're like, what's going on? Your body knows now that it's called the immune system, like the Th1 cells and the CD8 cells that are your normal body's response to something going on. Well, it's already so deep and it's already infected some of the cells that it's calling in the cytokines. The cytokines, let's call them the captains, right? They're the big dogs. They're the ones that kind of like they've got their hands in all of our immune system. And they're ordering more potent cytokines and natural killer cells, and they're soldiers that are actually fighting. So they're bringing in the big dogs, right? So like interleukin-6, interleukin-1 beta, natural killer cells. So you're going to hear me say these terms, and it's really important as we talk about some other natural things later on. So normally in this situation, this would do the trick. And it would be perfectly fine. The cytokines bring in our natural killer cells, our cytokines and whatnot, and then it quelches the infection. The infection goes away. And what happens is the T regulator cells from our gut system say, okay, that infection's done. I need for you guys to back off. I need the immune system to back off. We're good. But what's happening is with this infection, the SARS-CoV-2 is so big and bad, it's killing those two, right? So it's infecting them. So what happens is we're sending out more soldiers. So if you think about it, if you're going to call in the other big guns, so we're going to call these inflammasomes. These are stuff like, we've identified one of them is called the NLRP3, right? Inflammasome. So I want you to think about this as like an artillery tank. And if you're trying to get something in a window and you fire a tank, the whole building's going down, right? So inflammasomes, they're great, okay? But what's going on is now we've got the infection and we have the tanks going after everything. And this is what we call the cytokine storm. Okay, that's your cytokine storm, where everything's just shut down because the whole body's going haywire with an infection and your immune system kind of like, I'm going to help. Okay, so that's really what's going on with this virus. Yeah.
Wasn't that awesome? She has such a great way of explaining what's happening. And like the way, you put everything together and the way that you explain it, now people have like a visual understanding of what's going on in their body and what's affecting their bodies, right? So I was watching. Yeah, so I was watching one of the live video that you did where you had a system of like, your husband bringing in the groceries and what you had him do and what you did with the groceries. And why don't you tell our listeners some of that, and why do you go through such extreme measures doing that?
It's super contagious, like I said. So like if it's going to last on plastic for 3 days and cardboard for 24 to 48 hours, you want to make sure that you're protecting the people that you love. So you have to be really diligent about bringing packages and you want to clean everything. Only one person should be going out. you know, take your clothes off immediately. You're going to go shower immediately. It lives on your hair as well. So if you're going out, I really suggest that you cover your hair, especially girls. We don't want to wash our hair all the time. My husband comes in, he strips, he puts it in a washing machine immediately, upstairs to the shower, showers, brushes teeth, hydrogen peroxide in the nose, the ears, and brushes his teeth and washes the hair. Oh, it's a done deal. Because, okay, remember, you can be asymptomatic. So we don't want anybody getting sick in our house, and we don't want to get anybody else sick either.
Yes. Yeah. You know, I did not start doing or taking extreme measures like this until I watched that video. And I was like, oh my God, you know, like maybe I'm not doing my part. I've been at my house, I've been doing my social distancing, but I have not actually been practicing those different aspects of like making sure I take my clothes off and making sure I do all those different things before I, you know, interact with my family. So, which is really, really good.
Yes, nobody's allowed to touch him until he goes. And when he opens the door, he goes upstairs. My bonus son goes with disinfectant spray and sprays the handles and the light switches. So we're pretty.
Oh my God, yes.
Thorough, yeah. So
you can never be too cautious. You can never be too cautious.
None.
Hold on. Let me check if we have any questions, or I just want to say hi to my viewers real quick. I know we are lagging a little bit, so let us know how we are doing here. I'm not sure if you are able to listen to us, if the video is coming on clear. I see a little lag here and there, so please put in the chat how we are doing with the video. If we are lagging, are you able to listen or hear us properly? So I just wanted to say hi to all our viewers. Hello, sister. My sister Sandra's watching. Dr. Leslie, Dr. Andrea's watching. Dr. Jaquel, Jeff, how you doing? Dr. Wasila, well, Lisa, I always call her Wasila because we have a city in Alaska called Wasila. So I always call her that. Hello,
long on copper. Copper is 4 hours.
Okay, perfect. So yes, definitely let us know how we are doing with the video and if we are lagging a little bit. Okay, so I was told that the video is good. So awesome. So we are gonna go in the nitty-gritty because I know you all want to know what you can do to boost your immune system. So we talk about some of those prevention, social distancing, make sure you are cleaning stuff properly and all of that. But now let's go into, so what can you do to boost your immune system, to prevent this, or to have the tools if you do have it?
Yeah.
So you can actually go on the other side, right? So Dr. Samm, why don't you give us some things that we can do at home to help us if we were to have it or to prevent it?
So number one is to stay at home, guys. I mean, I don't know how else to say this. It's like teaching an old dog new trick. Like, you tell a dog to stay, they stay. I just want y'all to stay at home. Explain. So honestly, you're limiting your exposure to people and surfaces, and you don't know who has symptoms and who doesn't. You don't know who's contagious and who's not. I just explained why, okay? So if you do have symptoms, or if you've been tested positive, or if you have, so let me go over the symptoms right quick, okay? If you don't mind.
Okay. Perfect.
So intermittent means that it might happen one day and then not the next. So I do want you to understand that. And I'm not going to give them in any kind of order either. 1 is a fever. 2 is a cough. 3 is a sore throat. And you might have 1, 2, all of these. Okay. So just know them. Headache, loss of smell and taste. That's one of the newer ones.
Yeah.
Diarrhea. It also affects your GI and your gut system. Dizziness is one that I'm seeing in my patients. So like loss of consciousness and dizziness is one that I haven't heard people talk about, but I've had at least 2 people. And then shortness of breath is the hallmark scary part where you gotta go to the doctor. Okay, so I'm gonna say them again. So you guys need to know them, and I understand that some of these symptoms are also the symptoms of allergies. So one of the things with allergies to know the difference is you normally don't have a fever with allergies. Okay, so fever, cough, sore throat, headache, loss of smell and taste, and this is where that whole allergies comes in. Dizziness, diarrhea, shortness of breath. Okay, if you have those symptoms, right, just to be on the safe side, at least for 24 to 48 hours, you need to be in self-isolation. Self-isolation is at home, guys. So regardless, you're supposed to be at home, but if you have those symptoms, you really need to be self-isolated. And self-isolation means you need to be in a room by yourself, not watching TV with your kids and your family or your spouse. You need to self-isolate because you don't know if you're contagious or not. Okay, so self-isolation is really, really important. Right. Washing your hands is super important. So like I said, it's on the surfaces, but guess what? The virus needs a host, like I explained, but the virus is degraded. It's got around that corona or the spike proteins that I'm talking about, it's enveloped in in an envelope, and that envelope is made of a fatty layer. It's a fat layer. You can wash that away and you degrade it with heat at 56 degrees Celsius, which is 132 degrees Fahrenheit, more than 40% humidity, and also soap and water. So, you know, the hand sanitizer that y'all are using, that's great for it. But soap and water does a fantastic job. And just washing your hands, like wash your hands every 20 minutes or so. If you're out, it's super important for you to wash your hands. It gets rid of the virus. Wear a mask when you're out in public. So there's a couple of reasons to wear the mask. Okay, the mask is because you don't know if you're symptomatic or not. So you're protecting other people from your sputum. Okay, and then it's also kind of protects you from touching your nose and your mouth. It doesn't protect you from touching your eyes or your ears, but at least you're not touching yourself as you're going and picking stuff up. Okay, so it's really protecting other people from you. So the way I look at it is, if I was out and I saw somebody with a mask on, I'm like, wow, that was super thoughtful. You're protecting me from you. And when I have my mask on, I'm protecting you from me, just in case, right? So wear a mask and help each other out. Number 4 is to hydrate. And to hydrate pretty much every 20 minutes. So hydration is great for you anyway, regardless of viruses. It actually helps to detox you. So it's flushing toxins out of your body. It definitely helps with constipation and pooping out stuff. If that is what's going on, you're helping to clear it out. It helps with mental clarity. It actually helps to decrease your pain because you're lubricating your joints and your muscles. So it's a pain relief as well. And it also helps you eat less. So if you're drinking more, a lot of times when we think we're hungry, we're actually thirsty, right? So I plug in there for the Corona 25 or whatever y'all are calling it, as people are home and eating. Right. So drink more water. Now, caveat to that, I have heard that you're supposed to be drinking hot water and not cold water. I'm not really sure, because you're not going to be drinking something so hot that it's 132 degrees. But okay, hot beverage, I'm fine with that. So I don't have a say on the hot beverage versus versus a cold beverage, but every 20 minutes for hydration is amazing. Number 5 is to...
Let me add...
Oh, go ahead.
Okay, let me add a little to that. I know we are lagging a little bit, but yeah, I heard about the hot beverages as well. So like, you were supposed to add lemon and all of that to your hot beverage and stop drinking cold water. So I don't know how much more the efficacy of it all is, but hey, it's not... Hey, why not try it? Try it. So yeah, I just wanted to piggyback on that real quick.
It degrades in a warmer temperature. So I'm guessing that that's the theory behind it. I just, don't know about the temperature of like hot tea or a hot beverage, and if that would work. So
right.
eating low inflammatory food. So we know that this is an inflammatory process. We want to decrease the inflammation that we can do. So of course, no sugar. So sugar, regardless of what you're eating, when you put it in your mouth, whatever piece it is, it's going to hang around for 4 hours, and sugar decreases your immune system. So right now we're trying to increase the immune system. So sugar is a no-no. If you know your blood type diet is automatically anti-inflammatory, right? So blood type A's are supposed to be vegetarian. So beef up your vegetables. Don't eat red meat right now. Blood type O's are supposed to not have grains specifically. Blood type B's, no chicken and corn. And blood type AB's, no chicken and corn too. And kind of try to stay away from the grains as much as possible as well. And then we actually know of some in vitro studies that actually have foods that we know of that decrease the NLRP3 inflammasome, specifically associated with the SARS-CoV-2 virus. We can talk about that in a minute. Sleep. Sleep is super important, guys. Specifically right now, it's like God is telling you, okay, rest, go sleep. So
right.
Really, sleep recharges your battery. It increases your mental clarity. It helps with your mood because we're all stuck inside. So, grouchy, go to sleep and wake up on the right side of the bed, right? And it also, when you're sleeping, specifically between the hours of 10 p.m. and 2 a.m., it increases your melatonin. And melatonin is the natural hormone of the immune system. And we'll talk about that in a minute too. But you can get that naturally when you are sleeping. And then there's supplements. I mean, we have supplements that are evidence-based, researched clinically, that we know specifically decrease the NLRP3 and some of the cytokines like IL-6 or interleukin-6, interleukin-1 beta, which we know are now proven to wreak havoc and cause the cytokine storm. So we already know that there are some supplements like that. Also, don't take ibuprofen and Tylenol. And then I think one of the main things that I want to touch on is call your doctor if you're having some symptoms. Don't just sit there. Don't wait. We're like all doing telemedicine right now. So call your doctor and get triage.
Yes.
I just told you guys the symptoms, right? So if you're having some thoughts like, oh my God, do I have it? Do I not have it? Is it allergies? Is it not? Don't do the whole, Dr. Google thing. Just call your physician. We are there.
Right.
You. Don't go in. Yes. Don't go in. Call first, please. But we're there to help triage you.
Yes.
Yeah, for sure.
Yeah. Absolutely. Again, awesome information. I want you guys to make sure you share this broadcast. Make sure you like both our pages. Again, because we giving you lots of great information just to help you along the way. If you do have shortness of breath, make sure we have some emergency docs on our call right now. So make sure you have your shortness of breath. Make sure you triage. You call the hospital and say those are my symptoms, because we get a lot of people coming through the clinic and we're like, okay, well, we're gonna do it over the phone first before we have you come through the doors, right? So you can call your physician and let them know what is going on with you, and they'll let you know whether you need to report to the hospital or not. So you have your first line. Your first line right now is your physician, and then your physician will direct you to the hospital or not. So remember that. So I just wanted to really briefly say that. Thank you everyone for watching. I see Sabine is watching, Dr. Jennifer is watching. Thank you all of you for being with us. So Dr. Sam's going to continue with the conversation. Remember, the disclaimer is all of this for educational purposes only. This is not to replace your doctor.
Yes.
Okay, so make sure you check with your doctor, but she is gonna go and drop some more information on us. So go ahead, Dr. Samm, tell us like some of the things that we can do as for like supplements to boost our immune system and get us on the right track.
Some of the foods that I was talking about, remember I said that we have some evidence-based foods that we know of. So we know that 80% of our immune system is actually in our gut. So if your gut system isn't healthy, then your immune system's not working right. So remember I said that the T regulator cells that come and quelch the immune system from wreaking havoc, they come from the gut.
Right.
So if you have any food sensitivities, now's the time to adhere to them and not do them. So if you have a gluten sensitivity, now's not the time to be like, I just can't handle it, I'm going to have a piece of bread. Okay, this is not the time for that. Sugar.
Right.
We've already talked about sugar. We've already talked about blood diet. But some in vitro veggies, fruits that we know that specifically decrease the NLRP3 inflammasome that we know is SARS-CoV-2, and also some of the certain cytokines that we know that are in this virus specifically. So onions and garlic. Okay. So apples and berries, celery and parsley, licorice, which I have a disclaimer on. So licorice actually can raise your blood pressure. So if you have hypertension, I'm going to suggest that you not do licorice right now. And I'm not talking about licorice candy either. Okay. And then chamomile and peppermint are great. So that warm beverage that we were talking about, I can see chamomile tea or peppermint tea at night. That would be really soothing. And it also actually is super for this specific virus, right? So then supplements that we've already researched and have evidence on are zinc. So zinc, remember how we were talking about one of the symptoms is loss of smell and taste? Well, a zinc deficiency is loss of smell and taste. And one other way that you can know that you have a zinc deficiency, not that you would have it right now, is little white dots on your on your fingernails is also a zinc deficiency. So zinc actually protects the upper respiratory tract. It increases your immune system, and it's super effective specifically against coronaviruses in general. Okay. Melatonin is one that we've talked about. It decreases the NLRP3 and some of the other cytokines that we know that are in the SARS-CoV-2. It decreases oxidative lung injury. It decreases inflammation. We know that kids have melatonin 10 times the amount that adults do. And as we age, the melatonin goes down. So that's interesting, right? Because kids are not as infected with this virus as adults are. And this might be one of the theories. I'm not so sure, but melatonin is definitely being researched. We know that that one actually really is effective. Elderberry. So this one's super controversial. There is so much research on elderberry and coronaviruses. All right. We have clinical data with humans. We know that it is fantastic for all the coronaviruses that we know. We don't know about SARS-CoV-2 and elderberry, but we have clinical evidence specifically for all of the other coronaviruses. So what we heard in the news was, oh my God, actually causes cytokine storm. No, I already explained to you guys what causes a cytokine storm. Nothing causes that. It happens within your body. But I am going to explain to you that there was one study, it was in vitro in a petri dish or tube, in which it increased interleukin-1 beta, which happens to be one of the cytokines that happens to be in the SARS-CoV-2, right? So because we know it increases that, okay, let's be cautious. If you exhibit symptoms and if you're COVID positive, then you probably should discontinue the elderberry. If you do not, elderberry is perfectly safe to take right now. and it's very protective.
Mm.
It is antiviral. It is antibacterial. It is an immune modulator, and it has clinical efficacy, and we know it.
Mm-hmm.
Number 4 is vitamin D. So vitamin D is also one of those that we know decreases the NLRP3, also some other cytokines, but this is also one that increases interleukin 1 beta, which is that same cytokine as elderberry. So it has the same caution as elderberry. If you have symptoms or if you are SARS-CoV-2 positive, you're going to discontinue vitamin D as well. Vitamin C, fantastic. Lots of studies on this. The Chinese are actually using it. New York City and Houston are both doing it as IVs because we know that it actually affects this virus specifically. It boosts your immune system. It's antiviral. It protects your lungs. It's fantastic. So what the form we would want you to have is, of course, we like IV, but then liposomal, which you probably can't get anymore because everybody knows the benefits of vitamin C right now. So then I would suggest powdered form. You can do it to bowel tolerance, which means you increase by 1 dose each day until you reach diarrhea or abdominal cramps. So this is your personal dose. Once you reach that, you're going to back off by 1 dose, and that is your customized dose. It's the level at which your cells are saturated with vitamin C. And then the last one I'm going to talk about is vitamin A. And vitamin A it protects your mucous membranes specifically, and it also has some kind of toxic properties. So if you're pregnant, you don't want to do high doses because it's teratogenic, which means that it can abort the baby. And at high doses with toxicity, you'll have the worst headache you've ever had in your whole entire life. So I would caution on high doses of vitamin A. Those are the supplements and the foods that I know from the research, from what I've heard, from what I'm researching, what my colleagues are telling me. These are the things that we know for sure that are in that cytokine inflammasome that we know will work.
Wasn't that great information? That was so educational. It was so educational. We thank you for all that information. I know we only have just a few more minutes. I did want to go over fever a little bit. We don't have a lot of time, but in a few minutes, okay, so I do want you to touch upon fevers, to suppress it or let it ride, right? I saw this article yesterday, and that was the title: do we suppress our fevers or do we let it ride? So what is your thought on that?
Okay, so this all stemmed from that whole don't take ibuprofen article that came out with the elderberry. So we got to touch on the ibuprofen because that's what we told them we were going to do. So ibuprofen, I want you guys to know, is also Advil and Motrin. So don't think that Advil and Motrin are different. That is ibuprofen. It's a non-steroidal anti-inflammatory. And you would think that this would be great because we want to decrease the inflammation. But ibuprofen specifically is a COX-2 inhibitor. And this is going to affect the renin, angiotensin, aldosterone system. That's that ACE2 whole pathway that this SARS-CoV-2 loves and it attaches to. So what the COX-2 does, it doesn't allow renin to be produced. And if we're already stressing that system, we don't want to stress it anymore. And so that's the reason why they said they don't want you to take the ibuprofen. Tylenol specifically, actually, so they said, don't take ibuprofen, take Tylenol, right? So, but Tylenol decreases glutathione levels, and glutathione levels are absolutely necessary to have a healthy lung. It affects certain pathways, and we need it to decrease the inflammation. And specifically, glutathione thins the mucus, which allows us to expectorate and get out of our system, right? So all of these, both Tylenol, Motrin, ibuprofen, Advil, they're antipyretics, and they make you not have a fever, or they make the fever go down, and we want a fever. We want the fever because that's the body's signal. So remember, I told y'all in the very beginning that we don't have any symptoms. We don't have symptoms because the body doesn't recognize it. When we have antibodies, our body launches symptoms like a fever, and it says,
Right.
okay, let me go burn this up. When the cytokines are fighting and the Th1 cells and the natural killer cells, they will burn it. And so we mount a fever, and a fever is good. It's the body's natural and inherent way of healing ourselves. It's the vital force is what we call it in naturopathic medicine. What's really important for you guys to know about this fever is that when you have a fever of over 99 degrees, you should not be eating. You want to starve a fever, feed a cold. It's how you think about it. You starve the fever because when you're eating, right, digestion and your immune system do not compete. Your digestion shuts down because we need all the soldiers on the battlefield fighting the infection, and that's your immune system. So if you eat something, then the food's going to sit in your gut and putrefy. When it putrefies, it creates bacteria. Then that bacteria now makes it so that now your immune system has to go and fight even harder. So the fever is going to last longer and it's going to burn hotter, and we don't need that, right? So all you do when you have a fever of 99 degrees or higher is you want to drink water, and only water, until the fever has been less than 99 degrees for at least 6 hours. So in naturopathic medicine, really quickly, Dr. Firlande, the way we treat a fever is if it's 99 degrees to 102 degrees, we're going to do a warming sock treatment. And I'm going to let Dr. Firlande put it on her page what a warming sock treatment is. But basically, this decreases the temperature by at least 1 degree, or it might break the fever. It also eases pain and helps you sleep better. If the temperature is 102 to 103 degrees, we're going to do the cold towel treatment with a wool blanket on top on the abdomen for about 20 minutes. This is going to also help to decrease the fever. If it's over 103, you need to be under the care of probably a naturopathic physician in order to do this part of it. It's called a Spanish mantle. It's a hydrotherapy treatment that we do. It decreases the fever by 2 degrees. If not, it will break the fever for you. It's really, really important to fast the fever. And after you fast the fever on the water fast, you want to break that fast with an electrolyte broth of celery and carrots only. And then you can actually eat something. This prepares the kidney to be able to take the nourishment. And again, it's super important to fast the fever.
Wow. Wow. So much, and it's so much information. I hope you all were able to take it all in. I remember, when my child was young, and children, what do? If you need to know what to do, watch your children. Children, when they have a fever, they don't eat.
They don't eat.
They just want to drink, and they want to just lay there. They want to sleep because, again, you want to be starving that fever. And children actually know exactly what to do. They know exactly what to do. So I would love to continue this conversation. It's been so awesome. Thank you so much for all the great information. Is there something else, some take home you want to give our viewers before we sign off today?
Yeah, absolutely. So on my website, drsammnd.com, that's DRSAMMN as in naturopathic, D as in doctor.com. There is an 8-page handout that I have for you guys. It's on basic immune function, and some of the tips that I just told you is on there, some basic information, but it's 8 pages long. It's chock full of naturopathic information for you guys.
And I have her website right there, right in front of you. So go on her website and grab yourself those tips, because she is a wealth of information. She gave us a lot of information, and I so appreciate her for that. So I just wanted to thank you all for being on with us. We had quite a few people on. Dr. Anissa Firock, Dr. Leslie was on with us. We had Michelle on with us, Dr. Jada. So we had lots of people on with us. And so we do thank you, our viewers, for being on with us, and we appreciate you. I will be continuing this conversation the whole week. So catch me on live tomorrow. I think at the same time, 7 p.m. Eastern Standard Time or 3 p.m. Alaska time, where we're going to bring you some more information about COVID-19, what to do, how to stay healthy, and keep your family healthy. Any last thoughts or words, Dr. Samm?
Oh, thank you for having me. You guys stay at home, and stay at home. Be safe.
Yes, absolutely, absolutely. All right, let me go ahead and sign out. I am Dr. Firlande. I'm a licensed naturopathic physician. I am also an author, speaker, and your weight loss expert. You guys, if you need to stay abreast of what's going on, you can sign on to ND Health Chat. That's www.ndhealthchat.com, and you'll be receiving information daily on when to log in, when we're going to be coming on live, and what we're going to be talking about. So you definitely don't want to miss it. We're going to be on live tomorrow with Dr. Aisha. She's going to be talking about food, more food. We know food is medicine, but also food for the mind, body, and soul. Mind, body, and soul, because we cannot just feed our body. We have to feed our mind and our soul as well to make sure we stay healthy. So thank you all. Follow me on Dr. Firlande. That's DrFirlande on all social media platforms. Share with your friends and come back on live with us tomorrow at 7 p.m. Thank you, Dr. Samm. That was so awesome. Thank you, guys.
Bye.
Bye.